Good evening, I'm Alyssa. I'm going to be the day shift charge for the second floor. I'm going to go ahead and give you an end of shift report before I take off for the evening. So today we were fully staffed. We had 4 RNs and 2 patient care techs. We had 1 that was floated to the tele room. We had no orientees, no float nurses were required, and there were no call outs during our shift. Our census at the beginning of the shift was 25. We had 2 discharges home. Both patients were stable and discharged home without complications. As of right now, at the end of shift, we have 23 with 2 open beds, and EVS has been called to go ahead and clean the rooms. We had 1 one-to-one patient for altered mental status and confusion. The sitter has been there throughout the day to make sure that there's no falls or any injury. And we also had 2 surgical patients return to the floor post-op. Both are doing well, tolerating their diet as advanced, no signs of infection, no signs of respiratory distress. Both are doing good. And then on isolation, we have 2 patients on droplet contact, and we have 5 on just contact precautions only. All rooms are completely stocked with PPE outside. Please make sure that everybody does their job and does good hand hygiene and uses their PPE when they go in and out of the rooms. So as I mentioned earlier, we have 1 one-to-one. For fall risk, no restraints are currently in use. We have no elopements or suicide risk patients on the unit at this time, and we had no falls as of right now for today. No medication errors, equipment issues, or safety incidents were noted during the shift. Our beginning narcotic was 31 and ending was 31 as well, with no discrepancies noted. No patients asked for any narcotics throughout the shift, and so we did not use any. We have a few pending procedures and labs today. We have an MRI of the brain and ultrasound of the brain, both awaiting scheduling and transport, a TEE and echocardiogram. A CBC and BNP are still pending from an afternoon draw. Hopefully results should be posted soon. Please follow up on these if you get a chance. We had no equipment or supply issues noted. IV pumps and glucometers have been checked and working properly. The unit remains stable. House supervisor knows of any admissions of the ED, so please be prepared for possible new admits. We only have those 2 beds open at this time. And we had no significant family or social issues today. That'll be all for me. The unit is doing well, stable overall, 2 post-op patients to monitor, and several diagnostic tests pending. Do you have any questions for me regarding anything that we spoke about? Thank you.